It's gone quiet. We're ready to go. Good evening, everybody. I'm delighted to welcome you all to this beautiful room at the Lanesborough. Thank you to the Lanesborough for hosting us. My name's Victoria Woodhall. I am your guest host this evening, and I'm standing in for Francesca White, the Beauty Triangle founder, who is in fact here, although that wasn't a guarantee. She's with her hospital bag packed and ready, so we thought it prudent to have a plan B, which is me this evening. If we haven't already met, I am a health, beauty and wellbeing journalist like Francesca. I write for the National Press and I edit a website called Get the Gloss. I write on everything from biohacking to blusher to Botox. And I have a side hustle as a yoga teacher. You can find me teaching rocket yoga online on Trini Woodhall and soon at Try Yoga. If you're into yoga, please find me there. So we're here to talk about everything from the neck up this evening. So what happens to our faces over time? So we all know that our faces start to flag a little bit, maybe our eyelids are drooping, and our makeup perhaps doesn't sit as well as it used to. But there are solutions, and thankfully our experts here tonight are absolutely brimming with them. So when the Beauty Triangle launched, it was on a mission to empower and educate consumers about the very latest in beauty and well-being treatments, taking a 360-degree approach, but also to make that all-important personal connection with top experts in the field. And I am absolutely delighted to have three experts with us today who form our panel. So first of all, I'd like to welcome Professor Firas Al Niaimi, who told me his name rhymes with Miami, so I should have got that. Made less of a mouthful of that. He's one of the UK's leading dermatologists and laser experts. Sitting in the centre here is Professor Jonathan Roos, and he's an ophthalmic surgeon and co-founder of FaceRestoration. And at the end, we have Suzanne Martin, the Lanesborough's resident brow expert and founder of the most sought-after Couture Brow technique, and also a trained makeup artist too. So they will be spending this evening sharing all their insights for how we can offer bespoke ways to achieve facial rejuvenation, but also that respects the architecture of our face and our individuality, and to give us a freshness and a confidence without looking dumb. So we'll be hearing about cutting-edge surgical treatments, the power of makeup, and all the latest devices. A few things before we start, a little bit of housekeeping. You will have been handed a program with profiles of our three experts, some more information about them there. You'll also have a referral card, and you can tick a box if you would like to be connected with any one of our speakers, and we'll do the rest. So please hand them to myself or Victoria over there, and we'll make that connection for you. Please don't leave without your goodie bag. We have some products from Epiance, and also there's a voucher in there for FaceRestoration. Thank you very much. And we will have our usual Q&A at the end, so please save your questions for then after the main discussion. So before we start, I'd just like to hand over to each of our experts to say a quick hello. Firas, welcome.
So thank you very much for coming here. Good evening, everyone. My name is Firas Al Niaimi. I'm a professor in dermatology and laser. I work in two places. My main work is in Knightsbridge on Sloane Street, not too far from here, at the Taktouk Clinic, with my colleague Dr. Wasim Taktouk, who some of you may know. And I also work in 152 Harley Street. The best way of summarizing what I do is I bridge medical and cosmetic dermatology. So I still deal with some of the medical dermatological issues, but I also see the aesthetic side of dermatology, and I do laser procedures too. So it's a nice hybrid of medical, aesthetic, and laser dermatology.
Thank you. Over to you, Jonathan.
So, just like Professor Al Niaimi, Rachel and I, who run FaceRestoration, left the NHS about 2 yeyears ago to work full-time in the private sector. We try to make friends with lots of different people, because the people who come through our doors sometimes need a multi-faceted approach. We only deal really with the eye area, and some of the people who come see us benefit from makeup advice, benefit from laser, and we don't do everything, but we try to be really good at what we do, and that's the eyelid surgery part. And what's surprised me being in this industry is how much these other modalities can achieve. So I'm looking forward to learning even more tonight.
Hello, my name is Suzanne Martin. I'm a resident of the Lanesborough Club and Spa, and my treatment is Brow Couture. It's a semi-permanent eyebrow enhancement. The work I do is incredibly natural. So basically your perfect eyebrow semi-permanently. So it lasts approximately a year. So it's basically designing, creating and applying your fabulous natural eyebrow that lasts a year.
Fascinating. So we've got 3 takes on a similar subject, but I'm really fascinated to hear your distinct approaches to facial rejuvenation. Let's start with Firas. Welcome. Thank you so much for joining us. You work from the Tattoo Clinic in Knightsbridge, and you have a laser or a gadget gizmo for pretty much every concern. You are generally the first port of call for people who are finding age-related changes showing on the skin. What do people come to you for generally?
So, I mean, that varies, but in general, I would say the 3 main groups are discoloration, so that would be either rosacea, redness, broken capillaries, or brown spots, sun damage spots. So the spectrum of redness, broken capillaries and brown spots is one group. Then the textural changes, so dilated pores or a bit of acne scars or just rough skin and wanting a glow and refreshment. And the third group will be more bordering on the medical side of things, so acne or a few active spots. So it's, I would say it's redness, rosacea, broken capillaries, discoloration, brown spots, sun damage, and then texture improvements, pores, scars, smoother skin.
Yeah, I think it's fair to say, certainly in my own case, that you start to feel a disconnect between the face that you see first thing in the mirror and the person that you feel you are on the inside, and this is often what leads us to seek out help. Yeah,
and I think because in terms of some of the treatments and the injectable treatments that are being done, such as anti-wrinkle, relaxing injections and volumizing fillers, so I don't necessarily see much of that as a problem, but the sunspots and the increased redness and sensitivity of skin and the appearance of broken capillaries, because there's not much you can do to really prevent that. I mean, obviously sunblock is very important, but you may have started doing the injectables to prevent lines and wrinkles, and that can often lead to very good results. But still, without makeup, there are certain issues that some of my patients are concerned about, and that's redness, sensitive skin, and sun damage and brown spots, for which really that's where the laser will work in.
Yeah, fascinating. I mean, certainly lasers have come on in leaps and bounds. It can do so many things now. And as you're talking, we're really getting to the territory of putting your best face first. You know, it really is a confidence issue as much as a kind of a beauty issue for most of us. Which of you would you say are the issues that affect our confidence the most?
So it's things that are difficult to conceal, things that are difficult to hide. So often, so that could be textural irregularities, scarring, or age-related changes, jowls, for example, and then again things that are difficult to conceal in terms of a lot of redness or broken capillaries. So often things that are a little bit difficult to hide and to conceal, or require an effort to conceal with makeup. These are the things, and they are mostly on the face. These are the things that tend to cause patients to be more aware of them.
And for a typical person walking through the door with one of those issues, how would you approach that?
So I think the most important thing is it starts with the diagnosis. That's the key thing, is establishing what is actually going on, what is the diagnosis, because that will then lead to the correct plan in terms of prevention, because again that's very important. No matter what you do, without a good prevention plan long term, these treatments may not necessarily be very successful. So it's getting the diagnosis correct, establishing the trigger factors that, for example, with the case of rosacea, which is a very common condition where mostly women, it affects mostly women more than men. They have redness in the cheeks and the nose and sensitive skin, burning sensation, flushing. There are certain triggers that we know can trigger rosacea. That could be dietary, environmental triggers. So it's important that we have this discussion about eliminating the triggers and then giving a treatment plan. And in the vast majority of cases, that will be a combination of a skincare range because the skin, again, needs to be hydrated well, protected well in terms of depending on the condition. So, for example, if we stay with the condition of rosacea, which is a very common condition, there is often increased sensitivity of the skin because the barrier of the skin is disrupted. So we'll be looking into certain products that restore the barrier of the skin. And then we'll talk about the active treatment, which will be the laser treatment. And sometimes I may need to even prescribe a medical grade topical treatment. So it's getting the diagnosis right, establishing the trigger, outlining a plan in terms of treatments and prevention, and that treatment plan often will be a combination of skincare range or medical grade treatment, topical therapy. What I mean with that is a prescription, not a skincare line that has actually medicinal effect, and then laser treatment.
So it's a totally bespoke approach, but also one that you have to commit you may have to commit a certain amount of time to
Absolutely.
If it's a question of healing. Yeah.
And again, that depends on the severity. So you have a spectrum with many of these skin conditions. It's a spectrum. It can be very mild, and you may need fewer sessions, and to a bit more severe, where you may require possibly a more intense treatment and a few more sessions. If we talk about sun damage, that's different because often if you have a lot of, let's say, sunspots, as it's often referred to as sunspot, sun damage, that will be on the background of, again, relative poor quality of skin because of sun exposure. So it may feel rough, dull, some lines and wrinkles. So you're not going to just address the brown spots. It's very important to add in ingredients and treatments that are also address the rehydration of the skin, the protection, and the correction of the damage that's been done. So it's a bespoke treatment, but it starts with a very good, clear assessment, which really is the diagnosis and the assessment.
I mean, people might come in wanting the laser, wanting the kind of the big guns, but I guess
very often that is the case. They will come wanting a brand of treatment, so they hear about a type of laser, and one of the difficulties and one of the challenges we have is that there's a lot of misinformation online, be it on social media or online. There's some misinformation. Particularly I see that with in terms of the downtime afterwards. So patients, when you explain to them what they can expect afterwards in terms of the recovery time and the downtime, often that comes as a surprise because that is the one thing that's not necessarily correctly addressed and explained online. So not everyone who comes and seeks a laser treatment, A, is suitable for a laser treatment, but B, they may benefit from a different type of laser than the one they initially thought they would, because of, again, healing, downtime, and really what would work, because some lasers may not work or are not necessarily suitable for certain skin. So if you have for example, if you have very reactive, red, sensitive skin, some of the more aggressive type of lasers, such as such as laser resurfacing, is not going to be is not something that I would advise because of potentially the risk of complications is higher.
But, when we're talking about rosacea and acne, are they suitable for laser treatment? I know certainly.
So yes, but they will be suitable for a specific type of laser treatment. So if you have rosacea with redness and sensitive skin and broken capillaries, so the right laser will be a vascular laser. So that's a laser that targets redness and targets vessels. So that would be the more suitable laser, but not an aggressive type of laser that, for example, peels layers of the skin, which is what we refer to as laser resurfacing, because then you can have more redness and potentially more sensitive skin. So definitely the vascular laser, but not the aggressive laser resurfacing. And then for acne, again, it's going to be the type of laser that's really going to target the bacteria, the grease glands that are driving the acne process, and not, for example, a tattoo laser or a hair removal laser. And sometimes patients may not know because they're confused. They hear a brand and they'll say, I want this laser, but it may not be suitable for what they're coming in.
So we really need to put ourselves in the hands of somebody who knows our skin, who can see the kind of issues that we have, rather than offers a one-size-fits-all.
I think the way I would say it is, I mean, I totally agree, but the way I would say it is that I'm fortunate enough to have access to many different lasers, and therefore there is no pressure for me to necessarily commit to one type of laser treatment. And unfortunately, this is what I often see, is that patients may have been to a clinic which only have one laser, and therefore they're trying, often with good faith and with, they want to help, but it may just simply not be the suitable laser, whereas I have access to many different lasers, so I can very much direct the patient to the right type of treatment.
And what other kinds of treatments work well with laser? What do you combine with for optimal results?
I think this is a very good question, because not everything can be solved with laser. I mean, laser seems to have this aura around it that it's magic or almost magic, and it can do lots of things, but that is not the case. So it's very good for the redness, so the broken capillaries, veins, rosacea, because the lasers that are vascular lasers are around for over 40 years, and we know very well in terms of the physics and also from a lot of the research on what is the exact parameters, so that the success rate for treatment is very high. Also for sunspots and sun damage, that works very well, again, because there is a long history of the laser and a very good understanding. So for brown spots, for sun spots, sun damage, for rosacea, sensitive skin, redness, broken capillaries. And then when we come to the rejuvenation side of things, again, that depends on the skin and the degree of damage to the skin. But then we talk about the laser resurfacing, which is taking layers of the skin. Now that comes with downtime, and it's very important that we discuss this. But that can give very good results for the suitable skin type that is not very sensitive, not very pigmented, and for a patient who's willing to accept downtime and potential risk.
And what kind of aesthetic results can laser resurfacing give?
Well, it can give certainly tightening of the fine lines and wrinkles, improvements in the appearance of the texture of the skin. So the texture of the skin is going to feel smoother, and the lines and wrinkles will appear less deep. They don't necessarily always disappear after one treatment, and I think it's very, very fair to give a realistic vision of what can happen. But you will expect, with a good outcome treatment, you will expect less lines, less wrinkles, smoother skin, firmer, tighter skin, and an overall better quality of skin. So one of the metrics is in a female patient is that just the light reflection is better, the makeup sits nicer, and they get compliments from friends and family.
And all this is without changing the architecture of the face. So you look like you, but your skin reflects light, and your skin quality, which I think we're increasingly finding is, the kind of gold standard is having great skin quality and looking age appropriate, is really what we're all after.
Absolutely. I mean, we were talking about this earlier with my colleague. We spent the weekend in Paris. There was a large international cosmetic and aesthetic conference that brings in different specialities, and I just went to one of the sessions, and they were talking about things that we all know, which is the ideal beauty of skin is a skin that is smooth, free of blemishes, free of red marks and brown marks, and fewer lines and wrinkles, and with nice light reflection. So if you take out the redness, you clear the brown, and you have a smoother skin, because what happens, I mean, I don't want to get into the physics, but we all know that when you have a smooth surface, the light reflection is more homogeneous and specular, so that gives a nicer appearance, whereas when you have rough surface, so dull, rough skin, the light reflection is very diffuse, so you don't get that nice luminosity and shine. And I think this is one of the things that you can get when you have the right laser resurfacing is, as the skin surface is smoother, it is going to reflect light in a more specular, even way, and that gives the glow.
Yeah, and the picture of health too.
Absolutely.
Yeah, which is part of this kind of rejuvenation, really, that we're after. And I guess your makeup, as I'm sure we'll find out shortly, your makeup probably sits better on smoother skin, and you need less of it.
I mean, by no means, I'm not a makeup expert, but I have learned over the years to have these conversations and understand from my patients that it's not only that the makeup sits nicely, but the time spent applying the makeup and the amount of makeup being applied are reduced. So they often say, before I needed half an hour to put makeup on a thick makeup to conceal and hide or to look confident. And now it's just 10 minutes and less makeup and I'm ready to go. And for me, that's very rewarding, that change and boosting confidence.
Yeah, boosting confidence, that's a perfect note to end on our discussion of lasers. Thank you so much. So moving on to our next speaker now, Professor Jonathan Roos. You're an ophthalmic surgeon and you practice at the Lanesborough and at FaceRestoration. Can you tell us a little bit more about the typical person that comes to see you? You're obviously an eye surgeon.
I'd love to, but I'd also like to pick up on something that you said, which I thought was really interesting. You said that with lasers, that we don't want to be different. We want to look ourselves. So we don't want to change the shape of our face. And what's a little bit sad, of course, is that we all age. And as we age, there are changes. So even though we don't want to look, our patients don't look done, but we don't fill them, so they don't end up looking different in that way. But in fact, in our clinic, we don't like to use the word filler. We think of them more as lifters, because as we age, things start to descend.
Yeah.
And what the fillers are able to do, which I find makes them such an exciting new technology, is that they're actually able to give a lift. And so yes, you don't look like you looked, but you may look like you used to look, and that is, I think, even better. In fact, there was a study in a German university in 2004 that showed that of all the parameters in beauty, youthfulness is the most important. If you get people to do studies in a proper scientific way, that's what people pick out. They don't care if you have a blemish, they don't care if you're asymmetric or if you fit a certain ratio, but it's having that air of youthfulness. Yeah. And we see that throughout society. It's why people hypothesize that Kate Moss has been such a successful model, because she has certain features in her face which are quite childlike, and so that has then been reflected as beauty. So sorry, I didn't mean to
no.
But sorry, I get so excited in these things. There's another thing you mentioned, rosacea, and rosacea is really interesting because rosacea is so common in England, and particularly people of Celtic origin, but anyone who lives in dirty London. If we used our fancy camera here, which you're welcome to come for a free fancy camera photo if you want, and if you use the voucher in your pack, but basically it would show that almost all of you have a little bit of rosacea. And rosacea is interesting because it is linked directly to blepharitis and dry eye. So almost everyone has a bit of rosacea.
Really?
And as you age, almost everyone at some point in their life has an element of dry eye. And so even though we're trained as ophthalmologists, we've been brave enough to kind of branch out. And so we've also bought an energy-based device, but it's not a laser, which is a one wavelength. It's something called IPL, and it's a special IPL, and we're able to use different bits of the visual spectrum, so the different colors, to either focus on, as Firas said, on blood, or on pigment, or on water. And so all these different things we can then use to address. And the exciting thing is that if you go to your average ophthalmologist, and as we used to be working in the NHS, we didn't have these technologies available to us. It would be, here's a drop, here's a drop, here's a drop. And then studies have shown if you give a patient a drop, nobody uses a drop. If they do a study, in fact, they'll stand in the car park and they'll press the thing lots of times before they go in to see the doctor. So they can say, yes, I have used it with a straight face. But we have this new device now, which is called the OptiLight, and it's a form of pulsed light. And it just uses light, as Firas explained, to target the blood vessels, and that reduces the inflammation in the lid. It kills off a nasty little mite called Demodex, and it also kills off bacteria. And that's really exciting because it means that Rachna and I are now amongst the first ophthalmologists in the country who can make people with dry eyes drop free. Now, there's a huge body of scientific evidence behind this, but it's still quite exciting. And I don't know if you use IPL in your clinic as well.
I do.
So that's like, laser is one wavelength that's really intense. IPL is many wavelengths and not as intense. You have to come back and see us more often.
Is that a painless treatment? Do you need numbing cream for that? I've not come across that.
So Rash and I've, done
Can't
it for
imagine
ourselves.
it's painless if it's around the eye.
And funnily enough, you don't have to go that close to the eye with this to have an effect on the blepharitis. So I don't know if Firas has seen his dry eye patients get better just from treating the rosacea, but it's not painful. It feels like that. It feels like a little elastic band, but it's not sore. No.
Do you think more of us have dry eye than we realise?
Well, I think now during COVID, I think people have started suffering with it more. So when we sit like this and talk to people, we naturally blink a lot, because blinking means that we're not staring. Staring is kind of scary and intense, and people don't like if you stare at them. But if you blink away, you come across as really friendly. And so generally, when we meet people, we blink. But when you sit in front of a Zoom call or on a computer, or if you're reading, your blink frequency will go from a few times, like every few seconds, to maybe once every 10 seconds. And that means there's much more time for evaporation, and therefore much more time for dry eyes to develop. So we don't only do dry eyes, but I think when Rash and I founded FaceRestoration, our philosophy was always to we don't want our patients to suffer from our lack of knowledge. So if there's something new that's better, it's our duty to learn about it. And so we spend a lot of time at the sort of meetings that Firas was just talking about, picking up new technologies. And so we have lots of exciting things. Like the first investment we made was into this very expensive camera that does an automated skin analysis, because there's no point in me sitting there going, oh, it's a little bit red, but if I can put a number on it and say, look, your score is like that, it allows you to measure over time.
Yeah, you can measure.
And it means that we can be much more
too.
scientific.
Yeah.
It also does 3D reconstruction, so that we can, when we place our lifter rather than filler, nobody wants a full face. People want a naturally lifted, contoured face. And so again, we're able to use science there. We put numbers to things. And my background was I did a PhD in Harvard and Cambridge. And so numbers and being able to show that something has an effect is really important to me. The sort of like, oh yeah, you'll be better, is not as nice as, look, you are better because, the following numbers.
Yeah, it's often, as a client or patients, it's often really hard to track your own progress.
Yeah, it's also reassuring for patients, because patients, they forget. So when we do it, we sometimes have patients who will say, wow, that's amazing. And then they'll come back a week later and say, I don't think there was such a big effect. And then we put up the before picture and the after, and they go, did I look like that? And you think, yes, because we very quickly adapt to our new appearance. But sorry, I've been talking myself.
No, absolutely, it's fascinating. I didn't realise so many of us suffered from dry eye, but I imagine that then leads to kind of eye rubbing and all of the things we're told not to do to stop our eyelids from, getting inflamed and
well, for
saggy.
some people, it's a bit like the reason we went into aesthetics isn't because we, want everyone to be pretty, but we want everyone to feel confident and their best self. And if you have watery eyes, people will assume that you're sad. And that means that when you go talk to someone with your watery eyes or your red eyes, people kind of look and they'll break out in sympathy, and then everyone's standing around crying. And if you can sort that out, so everyone can
it's a nightmare for makeup too.
Absolutely. Well, I'm sure you have some special makeup that will not run. But it's the same reason why we use these lifting hyaluronic acid injections and Botox. It's not because we think they're fun. It's because, again, they can take an appearance, like you said. You want to reflect to society how you feel inside. And if you have a face that has become, through no fault of your own, sad, tired looking, then you project to the world something which is not the message you might want to project. And if we can change that so that you match how you feel inside, and it doesn't even have to be that way. If you feel bad on the inside, sometimes if you look better, you can actually have a positive effect. And that's a really exciting. So sometimes when we're feeling particularly arrogant, Rach and I say that we're soul surgeons, because we actually do something superficial, but it has an impact on the soul. And that's kind of, that's when we go.
Yeah. So typically, what would be the kind of patient journey when they come to see you about concerns around their eyes?
So lots of things happen in the face and around the eyes as we age. And in general, you can put it down to one word, which is a kind of complicated word, but it's called tensegrity. Tensegrity is the tension that gives integrity. So when you're young, everything is tight. The skin is tight, the bones are tight, the fascial layers are tight, the fat is tight, everything is nice and firm. And so everything sits high. And then as we age, everything gets a little bit less tense. So the skin gets a little bit less tense, the ligaments get a little bit less tense, the bones become they absorb, even in the jaw, the teeth start to refresh, and so everything becomes less tense. And so things begin to drop. And that's usually the underlying reason why people come to see us. And one of the manifestations of that is that they get hooded lids, sad looking droopy eyes, just corners of the mouth. And we can't address all those in the same way. Some of it requires surgery, some of it requires Botox, some of it requires lifting injections or fillers, and some of it requires IPL or laser, and some of it actually requires oral treatments. So there are many things that you can eat or various topical preparations. And so in order to, our aim is to be the best at what we do, and so it's then incumbent on us to learn about all these things. When you go through training as a consultant ophthalmologist, they don't teach you half of this stuff. So it's been a very intense learning curve, which is why I had to obviously meet up with Rachna, who as a woman already was leaps and bounds ahead in this stuff, because I didn't know what a retinol was or a vitamin C serum, but now I'm getting there slowly. But they help, and so if it helps, I want to know about it and I want to use it.
Can you break that down for us? Who would be a candidate for Botox fillers or a surgical option?
So, in general, almost all of us, if Botox is done right, can look better. I mean, obviously not if you're a child, because then you're already perfect. But as we age, things start to change. And even if you don't need Botox now, if you have it early, studies have shown that given regularly in small amounts, hardly noticeable, it can prevent things changing so that you need surgery later. And I don't want to have surgery. I mean, I love doing surgery, but I don't want it. And so having a little bit of Botox, for example, will help to prevent that. And the reason for that is because the face has muscles that pull things up, and it has muscles that pull things down. And if we can weaken the ones that pull things down, like this one here, the platysma, it means that you won't get jowls quite as early. And so
specifically around the eye,
around the eye,
help the aging of the eye.
So I'm an oculoplastic surgeon, and luckily for me, the upper lid, in general, it's a surgical problem, because even though Botox will lift the brow and it can sort of stretch the skin a bit, on the whole, once you have a hooded eyelid, it needs surgery. Some people who don't do eyelid surgery feel that that's not the case, and there are a number of energy-based things. There's something called the Plex or plasma pen, and there's various things. And on the whole, what they do is they, rather than removing what's become loose, they tend to burn it together. And so our most complicated patients are people who've tried to avoid surgery to the upper lid, which we've now made into a very straightforward spa-like experience. And
I like the sound of that. How
no,
is it?
So we had a patient the other day. It was amazing. We were operating, and she said it feels like a day at the beach. And I thought, well, I mean, thank you, but like that's a bit extreme. Surely it's not. It's not. I mean, it is surgery. But we had our lights on, and we had music, and we had infusions, and so it's all very calm. And Rachel and I tend to use a lot of so all our surgery is under local anesthetic, first of all. Well, that's quite unique because we do simultaneous bilateral surgery. Patients don't need to be on the table for a long time.
What does that mean, simultaneous?
So
one on one eye, one on the other?
Well, sort of, or we assist each other, but instead of having two hands working away, you've got four hands, and so it is kind of twice as quick. And it also means you have two people judging, and it means that any surgeon will make a mistake or can get things wrong, but it's very hard for a team of two to both mess it up. And so on the whole, because we continuously challenge each other to be better and better, we now have really good results. And so on the whole, for the upper lid, surgery is great. For the lower lid, there are many more options. And we like to, we don't push surgery on people. If there's a cheaper, easier, safer way with less downtime, then we're all for it. And so we tend to judge it depending on the patient. But what happens particularly in this area is that sometimes surgeons will remove too much. So we used to remove a lot of fat, because as the septum, which is this little thin cellophane sheet which holds the orbital fat, so your eyeball is cushioned by fat in the bony orbit, and as that septum that holds the fat back gets weaker, it bulges forward, and we can get these sort of bulges. And in the old days, people would chop those away and say, oh, it's bulgy fat, remove it, then off you go. But then that fat is your natural fat, and it's meant to be somewhere. And so what tends to happen in people who've had eyelid surgery 20 years ago is now they look extremely skeletized. So if you look at people who've had surgery a while ago, what we're looking for now is a much more natural result. We try not to remove fat. We try to reposition things. We try to bring the anatomy back to where it was. And that means using different modalities rather than just removing things.
And when we're talking about anatomy, are there certain ratios or mathematical formula that you adhere to or are mindful of when you're
So people love this stuff, but I think it's a bit of
lives?
pseudoscience, because I have seen beautiful people from all cultures and walks of life, but they all have very different shapes. And I've seen people who are beautiful who are asymmetrical. And so even if somebody, has I mean, it's a bit mean, but sometimes I use Rachna in presentations, and I take her face and I use a PowerPoint and I say, look, here she is naturally and she looks great. And then we take half her face and, you make a mirror image of it, and then we take the other half and make a mirror image of it. So you have her perfectly symmetrical, and it just looks odd. And so chasing symmetry is not such a good idea. And because symmetry is not perfection, that also means that there's no one formula. Because if there were a formula, then it should be at least the same, but people don't need to be the same. And there's actually a lot of strong scientific evidence for this as well. If somebody's perfectly symmetrical, we as humans, we find it a little bit and we have an aversion to it.
Interesting.
Like there's I don't know if you know this story, but when the Starbucks logo was updated, they first made a symmetrical Starbucks woman, and focus groups found that there was something not quite right about it. And then after that, they said, oh, it's because she doesn't have eyes. So they gave her eyeballs. And then they said, but it still wasn't right. And then they took the eyes away again and just gave her two blobs, but they made them asymmetrical. So she has, and that people were happier with. So next time you pick up your Starbucks cup, have a look at it and just go, oh, she's not symmetrical.
Yeah, so actually preserving people's asymmetry is in the
I mean, we don't try to cause asymmetry, but on the whole, a natural look. We're all I'm highly asymmetrical. I've never dared to do the thing because I would probably break me, but no, I mean, we are asymmetrical, and that's okay. And I think it's quite nice that we don't have to aim to be some sort of perfect being.
And that gives us a feeling of confidence too, that that we're our natural architecture is good enough.
Kate Moss, for example, has a squint, so her eyes are not aligned.
Yeah.
People consider her beautiful. Cindy Crawford, she had a nevus right by her mouth.
Yeah.
People consider her beautiful. So everyone has beauty in them, and our aim is just to kind of unlock that and bring it out a bit. And the most beautiful thing in a person is confidence. And if you have confidence, then you are beautiful. And it doesn't matter how old you are or how young and that is what we try to give people. And sometimes that involves a little bit of surgery, but not so much that you have to lose sleep over it. In fact, we don't let people lose sleep over it, because every single patient we operate on, we put them on a 3-way WhatsApp so they can reach us whenever they want. So that means they never have to worry, because as soon as they get anxious, they ping us a message and then we say, oh no, that's okay, don't worry about it. And we also do a Zoom call with the patient the night before surgery, so that they never have a chance to get nervous, because we all start thinking the night before, oh my God, I didn't think of that, and I didn't ask that. And then your blood pressure goes up and you don't sleep well. And by doing a Zoom call the night before, studies have shown that a good night's sleep reduces your pain perception massively. And so our patients have a good night's sleep, and therefore they think they're at the beach when they're not really. They're in our operating theatre.
Wow, that certainly is a feat to make us feel like we're on holiday. And I guess we come out looking like we've had a good old trip to foreign climes and look refreshed.
So I mean, everyone's different, and we have a couple of tricks, but I think the key thing is to spend time getting to know the person and finding out about their own risk factors, and then we try to tailor it to make it the best outcome and experience for that person. And people are different, and so we try to be flexible. And we all pick up different things, and that's the other advantage of working in a team, is that Rachna will pick things up while I'm talking away, or while she's doing something, I'll pick something up, and then together then comes this magic cocktail.
Wow, thank you.
On the beach.
Wow, yeah, can't wait. I'll be having a margarita with my blepharoplasty. That sounds fun. Thank you so much. Now moving on to our last speaker, Suzanne Martin. Welcome. You haven't come far tonight.
No, not at all.
So you practice here at the Lanesborough.
Yes.
You've been here for a few years now. And when we're talking about confidence, I mean, I imagine as a makeup artist and a specialist in semi-permanent makeup, you really see us at our most vulnerable.
I try not to look at the vulnerability though. I really absolutely agree with you, and I feel there's no template for beauty. I feel everybody is beautiful, and I feel it's my job to enhance your natural beauty. So that's what I'm looking at. And somebody may feel a little vulnerable when they come to see me, but I'm really not kind of tuning into that. And I feel like personally, you know, my treatment is all about the brow. So I'm demonstrating with makeup the power of the brow and exactly what I can do. You know, I can create more symmetry, but it's really about changing the expression and enhancing and just making them look happier and feel happier. But it's all, you know, about talking to them, getting to know them, and going really on a journey with them and demonstrating with makeup. And then I apply my makeup in a way that is semi-permanent. I feel personally as a makeup artist, makeup is something we should have fun with. When I was a makeup artist, I worked mostly with Christian Dior, so it's very much shoots and fashion, but it's something you want to change and have fun with. The brow, though, is something I believe you don't actually want to take off. You know, you do want a good brow creates so much. So I feel the rest of it is really nice to play with and have fun with, but it's all about the brow.
So you say a good brow. What is a good brow?
A good brow, my job as Brow Couture, I would say, is really designing your perfect bespoke brow. And that would be every single person will have a different brow. So, and as I say, I always work, first of all, I work with my camera and I will demonstrate with makeup. So I'll draw and then I'll take photographs. And once we're happy with what I've drawn with the makeup, I then use, actually it's a little needle, but it's more like a pen really. And the makeup is placed just underneath the very top layer. So it basically doesn't rub off.
Yeah. So how do you know who suits what brow? What do you look for in the face?
That's just something which is really weird. I've always done, even as a child, I would, any sort of glossy magazines I could find or get my hands on, I would, it's so weird, I would look at the models and just think they're just not, the brows are just not right, and I would draw over them. So it's always been my thing. And obviously as a makeup artist, I loved a good brow. And the rest of it was a lot of fun. But yeah, I do feel that, and then of course you have to apply it in such a way that's very natural. So you create this beautiful shape. I will then blend a colour, and within that shape it's the little hair strokes.
Yeah, so how do you know what a person's natural brow would look like? Because often we've either plucked our brows, we may have lost hair through a medical reason. Are you able to kind of see that?
I can. If I see a face, any face, I will just think, okay, so the brow needs to be like this. It needs to begin here, it needs to arch here, it shouldn't be overarched, it should be here. And it really does create expression. So if they're too high, you look a little bit surprised. If they're too close together, you look cross. There is really nothing, I mean, you obviously, I feel, understand beauty, and it's all about being unique. So all my clients have a different brow. And it's really just drawing with makeup and demonstrating to them and showing them how they could look, and I feel, should look, to enhance their natural beauty and their personality.
So what happens to our brows over time as our faces change?
We lose brows, and unfortunately there's nothing, I mean, I'm sure there's lots of things on the market, lots of products, but I have to say there are no products that restore or bring back that hair. It kind of seems to go to other places. So we lose the brow hair.
And does the shape of the brow change? Does maybe the arch drop?
Yeah,
or
so
we
everything
lose the tail,
will kind of drop. Yeah, but to create a perfect shape, obviously you need to have hair growing in the correct place, and very few of us even begin with that. And certainly as we age, we lose more and more hair.
So is there a perfect kind of ratio that you look for?
No, I would say definitely, this is artistry, definitely not science. That's my approach. So it's, I know it kind of sounds quite good, doesn't it? It's all the ratio and this.
Yeah, because you see all these kind of measuring things you're supposed to do, from the nose to the tail.
No, it does. I mean, I will just, as I say, I will just have somebody in front of me, and we have the spotlights in the room, and I will just draw, and they will see for themselves. And it's just like, okay, so this needs to begin here. We just arch here, we're not going to overarch, and you can see and then they can just see everything. Really, it's their expression changes, and then the expression in their eyes, really pops.
Yeah. One of your clients described your treatment as the facelift I never had.
I know, that was amazing.
Wasn't that good? Why did she say that? What happened?
Well, it is about lifting, definitely. So the tail should never be lower than the beginning. So it should either be the same or slightly higher. And I know the person, Fiona, so she had lost like the tail end. And I just created this perfect shape, which really, her face is just beautiful and lovely bone structure. But really, without anything here, there was like a vacancy. And so by just creating this perfect brow, everything then, it really did just give her that illusion of a facelift,
I certainly myself have suffered from a sort of thinning hairline with hormones, age, like many of us do. And when I had my brows done, it was like it added an extra dimension to my face that made me stop kind of fretting about my hair loss, because I had this new element to my face which just was like smoke and mirrors. It kind of sort of was a lovely way of distracting attention from other things. I think brows can work a lot harder than we give them credit for.
Definitely. I really feel there is nothing as transformative as a good brow, and I just demonstrate it every day, all day.
Can you tell us a little bit more about the nitty-gritty of a semi-permanent brow? Some people might find that a bit daunting to have. I'm sure most people have heard of microblading. That's not what I do. So microblading is basically a blade. They use a blade and sort of slice into the skin, and it's just a different technique. I personally prefer a needle, which gives me complete creative control. My little needle, which is like a pen really, just sucks up the colour that I've blended, so we get the right shade, sucks it up, and I'm drawing these eyebrows hair by hair, and then rather than sitting on the skin like makeup, it's being introduced just underneath the very top layer, so it obviously can't rub off. Yeah, and is that different to microblading? Microblading, does it put the pigment in a different place?
So they kind of cut the skin, and then I think they paint it over. I much prefer the results I get are a lot more refined, a lot more natural.
Certainly with microblading and the pigments that are used, and I've experienced this, when you get the fading, it can go a little bit either pink or green. Is that a concern?
I can't say that never happens. It rarely. However, I have to say most of my clients do like to keep the treatment going because they love it so much. If you obviously, all colours are made of layers, and some colours will fade before others. So if you had the treatment and then never had another one, eventually probably red is the last one to go. So you will be left with a little red residue until it fades out. So that can happen. But generally speaking, it's not something that my work, I'm not seeing that, no.
And do the results differ for different skin tones, or is it suitable for all skin tones?
Definitely, and that's something that really comes with experience. I've never appreciated how different people's skins are, and there isn't really a way of looking at somebody and knowing how, the colours change in the skin, that some skins accept the pigment a lot better than others. It's always initially a 2-part process with a month in between. So I create and apply these perfect eyebrows. I see my client again a month later to just refine them, and then they very, very slowly fade, and then they'll just come for a top up as they very slowly fade.
And would you need some kind of numbing cream for your treatment?
I use a really good numbing cream. So it's not uncomfortable.
No,
not at all.
And how long does the treatment take?
Each treatment, so the new client will see me twice, and I allow 2 hours for each treatment, so 4 hours, but usually an hour and a half. But I like to really get to know my client, and just, as I say, I always demonstrate with makeup, and I'll spend a lot of time, and I just want to show them what I can do. And then once I get, so I draw, and then it's just like, okay, I can see how that shape's working for me. And then once I start my work, and I say, okay, well, if you like that, you're going to love the treatment, because the treatment is so refined. It's really literally hair by hair, and that's when they're like, oh wow, because it looks really natural.
It's quite unique in that it takes away the fear out of some of these procedures, that we don't know what we're going to look like afterwards, and we feel like we're not going to look like ourselves.
Yeah.
So having that makeup first.
It's all about really enhancing people. You know, I just don't. I think it's sad when people really want to change the way they look. You know, and I feel like, you know, it is all about enhancing people's and making, as you say, making them feel good about themselves. And when you feel good, you know, then you make better choices. You know.
And I've heard that are we ever going to go back to the 90s skinny brow? And I'm stuffed because I've had microblading.
No, I mean, I honestly don't, but I think trends are very dangerous. I think with makeup, that's absolutely fine. And as I say, I love to have fun with makeup and different looks. The Couture Brow is really, I am designing and creating your perfect shape for your face. And I just, you know, all of this suddenly the eyebrows are going, you know, sticking up and like whatever.
Fluffing out.
It's just like the perfect shape for your face.
And once you've had a semi-permanent colour, is that a kind of a commitment for life that you have to keep topping up, or will it fade naturally?
Yeah, you don't have to, but I mean, most people do.
Because
like
they
want
love the
it makes them look, you know, and it's all, you know, people just say, and it's been quite interesting with the lockdown, you know, my clients are saying to me, or have said, Suzanne, I realise I can live without so many things as long as I have my brows, and actually, you know, hair and brows, or even they can, you know, hair they can do things with, but the brows. And you're looking at yourself on Zoom calls and all sorts of things. You know, I think less is more, but definitely a good brow, so important.
Yeah, I couldn't agree more. I'm definitely a brow convert. Oh, thank you. That brings us to the end of.
Can I add one thing about? I was just going to say, brows are fascinating. The reason we became occuloplastic surgeons is because we communicate a lot with this area. And what I love about your technique is that it's not a frozen brow, right?
Yeah.
She's drawing them on, but you can still, I mean, if you can't do that, you're not communicating. But what's also interesting to know is that there's only one muscle called frontalis that lifts the brow. But there are like 4, I think, or big corrugator procerus and depressor supercilius, so 4 muscles that pull the brow down. And so what happens, and naughtally, the frontalis, it stops about there, so it goes out like that, but it means that this tail, it only gets pulled down. So over time, your brow may look great there, and then it drops, and so you get the hooding here, and that's, so again, that's where Botox can be really helpful, because if you make some of the down pulling muscles a bit weaker, then you get, what Suzanne just said, you get that thing going up longer. Eventually you'll still have to come to us, but you know, it can delay you having to have some sort of brow procedure for years. And it makes your job much easier, right? If it's already sitting in there.
Fascinating. Wow, thank you so much. I've really enjoyed listening to each of your different areas of expertise, and it just goes to show that you know, that there's so much that we can do that's so in the kind of minuscule details, but that can make a huge difference to giving us back our confidence and an element of restoring the face, as you say, and. You know, all the aesthetic treatments, they are about looking better, but I think more they're about feeling better and liking what we see in the mirror first thing in the morning, and just feeling like we can put our best face forward. You can.
We've been talking about the face tonight, and the face is like one thing. It works as a unit. And what I've never understood is people who say, I will treat one area, or I will treat 2 areas. Because when you treat the face, what you do in one part affects another part, and you don't want an unnatural result. So I think when you go and see someone who's going to look after your face, you want them to look at you as a whole, not just, I mean, I'm not saying you don't, but it's about looking at the whole face, because if you do something here, it affects how the rest looks. It may affect the reflectance of the skin. It may affect, when we use the lifting injections, again, that will affect elsewhere. So you've got to look at the face as a one thing, and not just a, you know, I will have my left eyebrow done today, and I'll have my right lower lid tomorrow, and like it doesn't quite work like that.
I mean, there is an element, there was a great deal of artistry involved, isn't there? It's being able to look at someone's face and just know what small changes would make a difference. Thank you. I think we have time for questions. Oh, yes.
Question.
Oh, thank you. Who's your question for?
Suzanne. When you do your treatment, do you shape the eyebrow?
No,
for
no.
example?
No, so I will create for you the perfect shape, the perfect eyebrow shape. Any hair that comes outside of the shape, I will just tweeze away. Yeah, definitely wouldn't do that.
What happens then? It grows back, right?
Yeah, but it's actually so easy to do yourself. It should be almost zero maintenance. So just a decent pair of tweezers. You know, I'm creating this perfect shape, and you can see anything that comes out. It's pretty obvious. You can just take away.
Yeah.
Or you can go and see Firas, who has a
Well, you
permanent,
can, yes.
probably soprano laser for hair removal or something.
Not a soprano, but a barrel.
Yeah.
But, yeah.
Yeah. Do we have any more questions? Yes.
Question. Thank you so much. Another fascinating talk, and to have three experts top level in London is a unique opportunity to ask a question that is Dr. Firas and Jonathan together. So I treat people post-bleb, and of course we try to reduce the inflammation and enhance the healing, the wounding. And sometimes below the scar, even if it's very, very thin after the bleb, you have vascular conditions and capillaries that appear as red eye. So Dr. Firas is top vascular laser expert in London. Would you treat those with the laser? And my question to Jonathan is, would that affect the eyesight or anything if those capillaries are blasted?
Okay, yeah. So thank you for your question. So not every blepharoplasty scar will going to develop these vessels, but often that is when there is tension in the wound, because when you have a scar with tension, one of the things that you get as a response to the tension is increased vascularity, and actually the wounding is
What does
going
that?
to.
Sorry, what does that mean? Increased vascularity.
So you're going to make you're going to make more vessels. So you see that when an area that's being sutured is under a lot of tension, is very tight. Often what you see is you see some increased blood vessels on the edges, and that's just because of the wound is making more vessels.
So it becomes visible.
It becomes visible. So I think the first thing is assessing the scar and how much tension there is. Okay, but assuming that I'm happy with the scarring and the healing and there is no tension. For these vessels, yes, they can be treated, although if we're talking around the eyes, very, very important that we protect the eye as well, because the type of light that we're going to be using, the type of wavelength, so that's the color of the light, can be absorbed by the retina and can have disastrous effect on the vision if there's no adequate protection. So the eye needs to be numbed and special shields inserted under the eyelids to protect. And then this is where skill comes into place, using the small spot size with the right level of energy and pulse delivery that is as safe as it can be. But nothing is without hazard. But they can certainly be treated with the right eye shields, the right protection, the right equipment, and also the right assessment of the scar on the area.
Thank you. And
So I think,
would that affect
yeah,
the eye?
so eyelids are fascinating because they don't just cover the eye, they also help create what lubricates the eye. And interestingly, the main thing that bends light to focus it on the retina isn't the cornea, the clear part, the window of the eye. It's not the lens inside. It's actually the little bit of water on the surface. And we know that's true because when we cry, we all get super blurry vision, even though the eyeball itself is perfectly fine. So a small change in the fluid, this fluid on the surface of the eye, is all it takes to knock your vision. And so the eyelids, as I said, they're super exciting because they actually help make water for the eye, and they make oil for the eye, and they make mucus for the eye. And those three components create a stable tear film. When you have inflammation in the lid, one or more of those can be knocked off a bit, and it doesn't take much for your vision to get a bit blurry. So it's absolutely normal to potentially have a bit of blurry vision. Now we have a trick that reduces inflammation after surgery so that on the whole but it happens, some of our patients complain of, my vision's a bit blurry, but then, we have a good look and we don't worry too much about it. I think I really liked Firas's answer there, but there's one other point to mention, which is that scars have a natural evolution. So when you first make a cut, it's just a cut. And when you suture it shut, it's just two pieces of skin together. And then over the next 2-3 weeks, you get healing, and then you get blood vessels coming in as part of that healing response to help the cells that are working there to create new tissue. Over time, that will settle. And I would not advocate using any intervention early on. I'd wait at least 3-4 months. And usually those vessels, once the job has been done, they will just regress. And then if they don't, or if it's unsightly, or if there's a problem or a long-standing granuloma, then by all means you can address it.
I totally agree. And I think this is where what I mentioned about scar assessment. So you're going to have to assess, is it a new scar, is it an old scar, is there tension? But because, it depends on at what stage, and you'll expect with a new scar swelling, redness.
What is the typical downtime for eyelid surgery for blepharoplasty? When can you go back to work and go, I've just been on holiday?
So we recently had a patient who, because as I said, we put all our patients on a 3-way WhatsApp. Some of them send us pictures every day, and that's really nice. And so we recently had a lady who was about to go for IVF treatment, and she really wanted to have this intervention before she went through these cycles. And she also wanted to have a holiday before the IVF with her partner so that they could have a bit of fun before all this stuff started, which I think I haven't had to do it myself, but I think it can be really soul gut-wrenching because there's such big expectations, and then often there's disappointment, and then you have to pick yourself up. And we operated on her on a Monday, and then we took the sutures out on Friday, and she was on holiday in Gibraltar on Saturday. So it can be that good. And sometimes, depending on if they've had a lot of previous treatments, fillers, you can have a lot more inflammation because fillers can get inflamed at the time of surgery, and so it can then be 3 weeks or so. But on the whole, when we started in private practice, it would take us, our patients, they all looked fine by 3 months, but sometimes by 3 weeks they were still swollen. And now we haven't done any one thing, but we've done all these small little tinkering together, which mainly involves me listening to Rachna. And together we've achieved these results where people literally, they're okay by a week. I won't tell you what all those secrets are because our competitors may be listening and we have to have a USP. But they're not dangerous, and they're smart.
Thank you. Do we have any more questions? Yes.
Professor Firas.
Sure.
Yeah. Spots. Gosh, horrible conversation. I got a 23-year-old son. Never had spots. Then got bad ones. We're doing Roaccutane. We're doing everything. Yeah. But still gets like a huge pustule. How are you saying you could treat those? Because surely they come and go. How would you do that?
Yeah, I mean, you can treat, but it's important also to put on maintenance, because you can treat, for example, you can treat with a laser a spot, and you can expect improvement, so shrinkage of the size of the spot, less redness, less pain. But what we're not doing is completely obliterating and destroying the grease glands, which is from where the inflammation starts and the spots appear. So you can certainly get an improvement, but it will going to have to be complemented with some preventative measure as well. So whether that's a topical cream, in this case he's having Roaccutane, but it's usually going to be the laser as a sort of like an emergency treatment, and then maintenance treatment. It depends also on the phase. Is it an acne on its way out, and maybe just with laser treatments and some skincare products it will all clear, or is it something that's going on for a long time and its skin is under a lot of inflammation? In that case, we may resort to some prescriptive topical therapy, so some creams that are a little bit more stronger than just the skincare. But yeah, you can treat individual spots with laser. If it's just an isolated spot, then you can treat just individual spots. But often, obviously, you'll have a cheek with few spots. Some of them are larger than others, so it will be a combination of treatment of the entire cheek and then specific different settings, different spot size for individual spots.
What about IPL for that as a more global treatment?
Yeah, I mean, you can. It depends also on the spectrum filter that you are going to use, and it depends also on the skin type of the patient. So, So when you're choosing with an IPL, you're going to have to be mindful of the skin type of the patient, but also what filter you're going to use. And if you have a good IPL and you're choosing the correct parameters, you can treat that too. Yeah, absolutely.
What's nice about IPL, it's not as aggressive as a laser. it's still a strong treatment, but it's just you have to repeat it again and again, but it's non-ablative, so it doesn't.
You couldn't use that with Roaccutane, could you? Because Roaccutane, did I pronounce it correctly, it makes you so red anyway.
So, this discussion about using lasers or IPL with Roaccutane has two elements to it. There is the element of sensitivity to light as a consequence of Roaccutane, but this is usually observed with relatively higher doses, and people can be simply just sensitive to light, but also to a visible light spectrum. So when you're using IPLs or certain lasers that are within the visible light spectrum, the patient may be just very sensitive to light. But that's often when the doses are high. That's one. And then there is the other issue of a concern, which is no longer a concern among the expert body, given the evidence that we have, is that if you are on Roaccutane, isotretinoin, you can't have any laser because you will have damage to the skin. Now that is not the case, with the exception of the full ablative resurfacing, which is the very aggressive one. But so when you are on low dose Roaccutane and there isn't marked sensitivity to light, having a gentle non-ablative laser treatment is absolutely fine. So there is the element of you can't have it because of a historic myth, which has now been dispelled, and then there is the sensitivity to light with relative higher doses. So in that case, this is where history. You're going to have to see the patient to examine them, and then I do a test batch and take it from there.
Thank you. I think our panellists are going to be here for a few more minutes if anybody has any further questions that they'd like to ask them personally. But for now, I'd like just to say thank you to all three of our experts for all sharing your insights. Thank you. That's been so insightful and helpful. Thank you. And thank you to you for coming and to the Lanesborough for hosting. The next event is in October, so please follow the Beauty Triangle on social for all of the latest updates on what that will be. But thank you very much and have a good evening.
Thank you very much for
Thank you.